Thank you for joining us for an overview of the SoClean CPAP cleaner and sanitizing machine. We are going to walk through how the SoClean works, what comes with the product, step-by-step instructions on setting up the SoClean, using the SoClean, and finally, how to care for and maintain the unit. The SoClean is a sanitizer that uses activated oxygen to clean the entire CPAP unit and its equipment. Activated oxygen is a natural disinfectant, also known as ozone. This method of sanitizing is also used in hospital sanitizing, in water purification, the handling of cleaning and produce, and more. The SoClean works by generating and pumping the activated oxygen through the supply tube and into the humidifier reservoir, which sanitizes the water and inner walls of the chamber. From the reservoir, the activated oxygen travels through the CPAP tube and to the mask, reaching every crevice and eliminating all bacteria along the way. The activated oxygen is then filtered out of the chamber by a port, turning it back into the regular oxygen we breathe. The benefits of using the SoClean is there's no disassembly. It sanitizes the entire CPAP equipment without removing the CPAP mask, tube, or reservoir. The SoClean destroys all CPAP germs. It eliminates 99.9% of bacteria, viruses, and mold found in CPAP equipment safely and naturally without the use of water or chemicals. This is especially useful for CPAP users with low immune system or those prone to respiratory infections. You also save time with the SoClean. The automated CPAP cleaning cycle does most of the work for you, so little time is spent cleaning the equipment. Now let's go through the contents of what comes with the SoClean. Along with the main unit, there is a user guide, a power adapter, an injection fitting connected to the SoClean by a length of black hose. Along this hose is a check valve assembly. Installed inside the SoClean is a filter cartridge and a hose slot plug. Finally, included along with these items is a bottle of neutralizing pre-wash. Before using the SoClean for the first time, it is important to wash the CPAP equipment with the neutralizing pre-wash included. This pre-wash is a liquid solution created to remove fragrance from manufacturing processes or other cleaning agents. This step is important because previous cleaners used or new CPAP equipment can cause a strange fragrance when used with the SoClean. Add about a quarter of the supplied pre-wash to a gallon of water. Then wash the mask, CPAP tube, and humidifier reservoir with the pre-wash and rinse thoroughly with water. Besides doing this before using the SoClean for the first time, you can use the neutralizing pre-wash whenever you hand wash your equipment or when introducing new CPAP supplies to the SoClean. It is recommended to still wipe supplies down around every 8 weeks to remove organic matter like dirt. The injection fitting establishes the link between the SoClean and the CPAP equipment. This fitting comes attached to the SoClean by a long length of hose. It also has a shorter length of hose coming from its interior. This shorter hose gets inserted into the humidifier tank. Do this by removing the main CPAP tube from the humidifier port and feeding the smaller hose through the opening. You want it to rest on or near the bottom of the humidifier chamber. It may be necessary to trim the small black hose to get a good fit. Continue feeding it until the black plastic fitting is firmly in position on the spot where the main CPAP tube once attached. Some machines with different humidifier chambers may require different approaches or accessories to hose insertion. Please check the compatibility chart provided. If the CPAP unit has no humidifier, remove the short length of black hose from the plastic fitting by pulling it straight out. Then place the fitting onto the CPAP machine in the spot where the CPAP tube attaches. With the fitting now connected, reattach the CPAP tube to the end of the SoClean fitting. If you have a heated CPAP tube that connects to and is powered by the main CPAP unit, You'll need a special adapter to continue using the heated tube along with the SoClean. To set the SoClean timer, power up the unit by plugging the AC adapter into the back of the SoClean and then into a wall outlet. Now set the clock by pushing the button with the clock icon and pressing the plus and minus buttons to set the current time. Then press the clock icon once more to store the time and to go back to the home screen. Next, we will set the duration of the cleaning cycle and the cycle start time. Please keep in mind when selecting the cycle start time that a 2-hour rest period is needed before you can use the mask and machine. The SoClean comes preset to start a 7-minute cycle at 10 a.m. every day. Change these settings by pressing the hourglass button. You'll be prompted to set the run time, which is how many minutes the SoClean operates during its daily cycle. Increase or decrease these minutes by pressing the plus or minus buttons. 5 to 10 minutes should be enough to completely sanitize the equipment. Press the hourglass icon once more and you'll be prompted to set the time of day you would like the SoClean to begin its cycle. Again, press the plus or minus buttons to get the desired time. Finally, press the hourglass icon after you get the correct time to store the settings and return to the home screen. After the settings are stored, the SoClean is ready to use. Begin by opening the lid and placing the mask into the chamber, allowing the attached CPAP tube to rest in the open hose slot. You can put the mask and tube in from either side of the machine. To change sides, remove the hose slot plug from its position by lifting it straight out and inserting it into the slot on the opposite side. With the mask and tube in position, close the lid firmly. The SoClean will now operate according to its preset time and duration. The SoClean will never operate without the mask and tube in the closed chamber. Neither will it operate if the hose slot plug is missing or positioned improperly. When sanitizing, even though the runtime is around 5 to 10 minutes, it is important to remember to leave the mask in the closed chamber for an additional 2 hours. To assist patients with this, there are color indicator lights positioned below the clock display. Red means the SoClean is operating. Yellow means the cycle is in its 2-hour waiting period. Green means that all sanitizing is complete and the mask is ready to be removed. To sanitize equipment apart from its scheduled cycle, simply place the mask inside the SoClean like normal and press the manual button. The SoClean will then operate according to the preset runtime. The store timer settings will not be affected. Like normal operation, wait for the green light before removing the equipment. There are a few things to do when looking after the SoClean. Keep the SoClean clean and dust-free by wiping it down with a damp cloth when necessary. The check valve assembly, located along the length of the black hose, prevents water from the humidifier reservoir from backing up into the SoClean. If you can see water in the clear section of the tubing, the check valve assembly should be changed. It is recommended to replace the check valve assembly every 6 months. The display screen will flash reminders to make the replacement when the time has arrived. The filter cartridge is also recommended to be replaced at the same time. Thank you for joining us for the overview of the SoClean CPAP cleaner and sanitizing machine.